Good afternoon, everybody. It's a beautiful day here in Virginia, and we're so glad that you could come out today and join us. Welcome to Focus on Reform, What's Next for Children's Coverage. My name is Rebecca Mendoza, and I'm the Director of Maternal and Child Health at the Virginia Department of Medical Assistance Services. The purpose of today's meeting is to highlight the upcoming changes under health reform and to discuss how those changes will impact the children's health programs in Virginia. Today's meeting would not have been possible without the support of the Robert Wood Johnson Foundation Maximizing Enrollment Grant. Virginia was one of 8 states to receive this grant, and we have worked very hard to achieve the goal of improving the enrollment and retention of children's health care coverage in Virginia. Now, I have the pleasure of introducing to you Dr. William Hazel, Secretary of Health and Human Resources for Governor McDonnell. Secretary Hazel has been a champion of making it as easy as possible for Virginia families to access health services in the Commonwealth and has strongly supported the work of the state's Maximizing Enrollment Grant. Secretary Hazel has also worked tirelessly with Virginia's Health Reform Initiative Advisory Council and its 6th task force to address important health reform issues in Virginia and to prepare for significant changes in our health care system. Without further ado, here's Dr. Hazel.
Thank you, Rebecca. Appreciate being here. Actually, Director Jones can't be here, so she sent her secretary. Good, you laugh. That's good. I just wanted to check and see who was out there. No, it's good that you all are here. Obviously, you're our partners in ensuring that these kids get enrolled in Medicaid and their families are appropriately enrolled in all the programs in which they're entitled to be enrolled. And it kind of starts on the ground with the work that you do. So we appreciate your being here to participate. I am going to have the opportunity to speak to you a little bit later today, and I believe Rebecca has assigned me to talk to you about the health system reform, the Virginia Health Reform Initiative, a little bit about the computer transformation or the IT transformation we're doing in social services or in more in health and human resources, but that's later. And then even later, you'll get to hear from the commissioner himself, Mr. Martin Brown. He even looks like a commissioner. Notice when he comes up, he dresses well and looks, yeah, he looks the part. But anyway, the commissioner's going to talk to you a little bit about the portal for health and human resources. So we'll get to that later. But before we get to torture you, we get 2 good speakers. And that's a good thing. You get the good stuff first. First, we're going to have Joan Alker, and Joan is the co-director, I had to read this, co-executive director at the Georgetown Center for Families and Children. Her work focuses on health coverage for low-income children and families with an emphasis on state Medicaid initiatives, including waivers, premium assistance policies, immigrant issues, and cost sharing. She has over 20 years of experience working on issues affecting low-income families because she started in kindergarten. Isn't that right? Something like that. And Joan will be giving us an overview of health reform legislation and outlining the new policies that will affect us going into the future. And after Joan, we get to hear from Jenny Kenny, who is a senior fellow and health economist at the Urban Institute, and she's a nationally renowned expert on the CHIP program, the S-CHIP, Medicaid, and on broader health insurance coverage issues. In particular, the Urban Institute has been involved with our health reform initiative in helping do some of the modeling to predict the coverage gaps, insurance costs, and so forth under the various models that we're proposing for the health benefit exchange. So she'll give us, she says, lots of data. Jenny Kenny's data dump. That's what we're going to get, right? Got it. Okay. So I think we got a real good afternoon ahead, and get all this good information before Martin and I come up here to put you to sleep. And then when it's all done, there will be a question and answer period. And I remind you, somebody said this is your opportunity to question the secretary. And Rebecca was commenting, she says, you know, well, you'll hear from us and then you get to ask us a question. It'll be just like being at home for me. I tell them what I think and then I get asked again, what did you just say? So see you later.